Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, pediatrician, and creator of the Doctoring Differently digital course that teaches physicians of all specialties how to find and explore flexible, lucrative careers beyond full-time clinical medicine. For more information, visit doctoringdifferently.com. Joining me today, I have Dr. Roberto Montenegro, a board-certified adult and child psychiatrist based in Seattle, Washington. Dr. Montenegro is a first-generation college student from East Los Angeles, California. He completed his PhD in sociology at UCLA, focusing on race, racism, and doctor-patient communication. He went on to receive his medical degree from the University of Utah, then complete adult psychiatry residency at Yale University and adolescent psychiatric fellowship at the University of Washington. I'm so excited about this conversation and all of the guests on the podcast. You won't want to miss any of them. Subscribe to the podcast at Spotify, Apple Podcasts, or wherever you get your podcasts. And subscribe to the Doctoring Differently YouTube channel to watch all of the episodes on YouTube. And now for my conversation with Dr. Roberto Montenegro. So I'm so excited today on the podcast to welcome Dr. Roberto Montenegro. He's a child and adult psychiatrist based in the Seattle, Washington area. Welcome to the podcast, Dr. Montenegro.
Thank you. Really happy to be here.
Great. So, as with all guests, I like to start with your medical school experience. Where did you go to medical school? How was your experience there? And why did you choose psychiatry, child psychiatry and adult psychiatry as a specialty?
Okay. So I ended up at the University of Utah for medical school there. And it was a great time. It was challenging in many different ways, going from East LA to Salt Lake City. Quite a contrasting experience. And it was great. You know, I ended up loving the outdoors, snowboarding, skiing, and had a great time. The training was amazing. The challenges I encountered were really preparing me for future challenges, you know, and being in a less diverse academic institution than what I was used to was also very helpful and challenging and helpful at the same time. So overall, you know, it has its good and bads, and net positive though, you know.
Good.
Yeah, loved it in the end. The training, like I said, was phenomenal. I ended up in psychiatry, really deciding between three very different fields. Ultimately, with the help of my spouse, I ended up realizing that I would go crazy speaking to my specimens if I went into pathology, and OB was just too chaotic of a lifestyle. And I knew I wanted to work with children and adults, and I was good at talking to people, and my background in sociology also informed studying human behavior, and psychiatry was a very good fit.
Great. So you went east for residency. How did you enjoy your residency experience? I found that many physicians, you know, really do enjoy residency, but of course it is a grueling time, and we're told, and many of us have found not to be true, but we're told that it'll get better at the end of residency. But how did you enjoy your residency experience in New Haven?
Oh, I absolutely loved it. It was probably the highlight of all of my different educational experiences. A training at Yale was just phenomenal. And again, it was just brilliant to have some of the leading experts in psychiatry teaching you the types of experiences working with underserved individuals and wealthy individuals, and getting trained in very complicated internal medicine as part of intern year. All of it was just amazing. It was the highlight, like I said, of many years of different forms of education that I've taken. And New Haven, you know, it's charming. You know, New England, it was a good experience for me to leave the West Coast, which we all know is the best coast. But, you know, leaving for a few years was great. And it just exposed me to a lot of people, including future colleagues that I would not have had the privilege of being exposed to if I would have stayed in the West Coast. And the type of training, I wanted to make sure I had strong psychodynamic training, not only behavioral training, and the West Coast schools are mostly, they tend to be stronger with behaviorism. and some of the East Coast schools are a little stronger in psychodynamics. So it was intentional in doing that. I knew that I would go back to the West Coast for my child fellowship.
Understood. Okay, so the decision was made at some point during your time, during your residency at Yale, that you would pursue child psychiatry after your general psychiatry residency.
That's correct.
So we made the decision to head back west to the Pacific Northwest for child psychiatry. How was that experience as a fellow?
That was great. You'll have to forgive me. I have to feed my chief happiness officer. I notice he's behind me. And if I don't give him a treat, this is also otherwise known as my practice chief happiness officer.
Chief Happiness, if this part is not edited out, you all should know, if you're not watching, there is a beautiful Bernese Mountain Dog sitting on the couch behind Dr. Montenegro, looking straight at the camera at me. So I feel like I'm interviewing two people.
Yes. So it was great going back to the West Coast, and the Pacific Northwest was new to me. Very shocking experience, going from the East Coast. I love the directness of people's communication style. I love the type of directness in my training and interactions, and that clashed a little bit coming back to West Coast and Pacific Northwest and Seattle specifically. So again, a lot of lessons in the challenges and going from coast to coast, and the training was phenomenal, and I did indeed get the behaviorism that I was looking for: cognitive behavior therapy, dialectical behavior therapy, parent management, a lot of the geeky kind of evidence-based practices for just making sure that my psychiatric care was well-rounded. So really loved it. I ended up staying on after fellowship as junior faculty there for a while. So that's where I started my career. Okay,
so I was about to segue into that. So you sound like someone who really enjoyed the academic experience, and that, having all of the diverse training, the mentorship, the students, a very well-rounded experience. So even as you described it, it felt like staying in academics was probably the next best step and the right step for you immediately following your fellowship training. So tell me about that first job. Did you stay at your home institution where you trained for fellowship, and how were those first few years as an attending?
I think you're sharing some tidbits that I think from some of our work together and our background in working together in the past as you helped me in this journey. But yes, you're alluding to my socialization into academia, right? And so doing my PhD in sociology first, I was definitely socialized and indoctrinated with the idea that I would be an academic. And my whole journey was to become an academician, be at a top-tier institution, continue to publish, continue my work in research with studying racism, microaggressions, and the impact of racism in medicine. That was my big goal, is to continue that work. And so throughout my training, I continued to teach medical students. I continued to do research. I continued to publish. I continued to apply for grants. And my first few years as junior faculty, I did stay at my home institution at the University of Washington. And it was a really great place to start as a junior faculty. I had a really amazing department chair, and a pediatrics department chair also took a special interest in my work in bias reduction and anti-racism training. And I was pretty set up academically to just continue in that path of publish, get grants, teach, practice medicine, right? And that's all I knew. And it became very apparent at the beginning, that this wasn't really everything I thought it was, right? I was seeing how much of a big toll it was taking on myself and my family. And I was noticing that really a lot of my colleagues that were leaving because they were being treated like they're disposable, right? And they would pour their souls and hearts into the work, and politics would get involved, financial, you know, inequities would start becoming a bit more apparent, and then the natural resentment, and then put that on top of that, the role that being a physician of color, right, plays in academic institutions, especially mostly being white dominated academic institutions. You can see why it creates a high likelihood of burnout.
Yeah, I see that. Sure. Okay, so sounds like, I felt you choosing your words very carefully there, but very well articulated and well said about the challenges that so many physicians face entering academia, but particularly physicians of color, Black and brown physicians, and a lot of the work we find ourselves doing a lot of that labor. Of course, in the past few years, there's been a lot of DEI speak and talk, but sometimes there's not a lot of action behind it from these large institutions either. Okay, so it sounds like there were very good parts of your training initially at the University of Washington. Your fellowship was a great experience. Your first few years as an attending, as I can identify with that I was at a large academic institution for those first few years and got excellent training, and I felt that was a great first step in my attending journey and attending career. However, we got to a place where, despite not having exposure or really being told about too much about life and work outside of academia, it sounds like you chose to make a change. It sounds like it was time. You got the experience you needed, but there were also other factors that made it obvious that you needed to move to another place and space in your career. So tell me about that transition out of full-time academia.
It was a very, very, very tough transition time. Tough because many of us get, like I said, indoctrinated into the thought that you went into medicine to help people. The best way to help people is to work at a hospital or academic institution. If you're being groomed into becoming an academician. And it was really terrifying to think that all these years I spent working on my PhD and all these other trainings and fellowship, that I would leave the comfort of academia, despite how toxic it would feel sometimes, despite how rewarding it was at times. Leading that was very frightening, right?
Yeah.
A lot of us become dependent on these large institutions, thinking that, well, they're paying our benefits, they're paying our disability, they're paying our malpractice, and all these other things that eventually, in working with you, you were able to tell me, no, it's like, you don't need to feel tied to an institution, especially if the institution's not really treating you in the manner that we deserve to be treated, right? And again, not at fault of any particular individuals, but really how our system in medicine works, right? And so I was very scared. I thought, okay, no one talks to me about what it's like to be a psychiatrist outside of academia. Like you said, I did feel ready in terms of my clinical skills, right? All these years as an attending, teaching residents, teaching medical students, teaching fellows, super amazing for my comfort in dealing with medicine and psychiatry. But taking that leap was something that I wasn't ready. And it took me a while to get there. And really, it was a kick in the butt that I got in terms of just being fed up with the inequities that I was experiencing as a junior faculty of color. And having support of other people that I was able to reach out, and they said, you'll be fine. This is what you need to do. And so once I saw that there was a little bit of structure, and that it felt very risky. I didn't know, in my fears, right, I would end up opening my private practice and no one would show up, right? And I had that fear lingering. And so I decided, let me just do part-time private practice, and then stay in academia half-time. That way I can keep my grants, keep my research going, and try this private practice world out at the same time. And luckily, my department chair agreed, and that's how my journey started with this 3 years ago now.
Wow. Thank you for being so transparent about your fears and your hesitation. I think, as physicians, we don't want to show that side, especially as it relates to our career. We want to act like, we have it all together. We know exactly what we're doing, what we're going to do. We want to be able to future cast and predict what any next steps. We want to have it all charted and planned out.
Absolutely.
If we move. That's our personalities. Yes. And that has been our educational journey, right? Our undergrad and grad school and medical school and residency and fellowship. So to get to our mid-30s, late 30s, 40s, for many of us, and to maybe be in an academic place or a institution, even clinic or private practice, but feel like, okay, if I were to leave, what does that look like? And even as you describe health benefits, something as simple as health benefits and maybe malpractice or retirement, those things we're never taught how to do on our own. And many of us feel like we can't learn it, or maybe we don't see someone else doing it. So I really do thank you for for articulating that journey for you and kind of your mental space along the way. So 3 years ago, you it sounds like you made those first steps and you went part-time private practice, part-time academic, which is always the advice I give. It doesn't have to be a leap. It can just be those steps. Yeah. So you still had the security as you took a step out of academia. So what did the rest look like?
It was a journey. It's been exciting. It's been super rewarding. And, I did start very slowly, again, very fear-based, fear-driven behaviors, right? I started off with, okay, well, let me try one Saturday and see how many patients I get. And that filled up. And I said, okay, let me try adding 2 days a week. And then that filled up. And I said, okay, now I'm up to 3 days a week. And I have patients, right? And it was quite phenomenal to see that I was able to actually practice psychiatry the way I wanted to, right? One of the other huge impetus for getting me to really reconsider this academic journey was, as many of your audience members might be able to relate, when you become so specialized, it sort of takes away from some of the bread and butter of the field that you went into. And I really missed working with adults. And I really wanted to use my research with burnout and bias in the medical field to help adults, and in particular physicians, deal with their own journeys in mental health and struggles and politics and everything that I had gone through in my years as a junior faculty. Cope with them in a different way, in a healthier way. And I missed working with adults. So I ended up seeing more adults, and I would see the children when I was working for my UW and Seattle Children's Hospital. And I saw that balance of being able to work with adults, do therapy with adults, do medication management with adults, start seeing physicians, just so rewarding. And it's been really amazing since then.
That's great. You again touched on, I think, a very important factor here. When I speak to specialists and subspecialists and physicians who have done so much additional training, they absolutely feel pigeonholed in that specialty. Yep. And, I think part of it is well-deserved pride in your additional training and what you do, and that you went for extra years down the road and maybe had another board of certification there. Right. But as you describe, you really can isolate yourself and make it so that, if say you're a pediatric cardiologist or nephrologist or something like that, a small town community may not need many of those. So, you've almost overqualified yourself for at least a smaller community. And so that, for those, a lot of these specializations, you're forced to be at these large academic institutions. And as we've discussed, all of the other things that can be involved with working at large, in large academia. So I really enjoyed the part where you said that, you remembered, hey, wait, I'm a adult psychiatrist too. Yes, I've done additional child training, but I can have it all. So, you can be a cardiologist or a gastroenterologist and also, rely on your internal medicine training at some point if you're interested, pediatric specialist, but also a general pediatrician, a surgical specialist, but also a general surgeon. So, you're two doctors in one.
Yeah.
And I think there's incredible flexibility in that. So I'm happy to hear that you returned at least to some part, and sounds like a very well-rounded practice that you have now, particularly where you treat adults now, particularly physicians.
Right.
So
it's rewarding, right? I'm able to, in my mind, to see the adult both through a child lens and an adult lens. So this, I really enjoy this freedom, this relief, this sense of calmness that I was able to get to. Sure, at the very beginning, I thought I'd end up broke and back into full-time academia, and then, which again is not broke, right? So in hindsight, even if I quote unquote failed,
sure,
it's not really failure, right? I would still be financially stable. I would still be doing well. So taking that risk has been rewarding, right? And, another thing that you were great at encouraging was also just thinking about diversifying your sources of income, right? And so I still have a small amount from my university job. The majority of my income comes from my private practice now. And within my private practice, I have gained some contracts. And I really enjoy that because as a private practice provider, oftentimes people can miss seeing the populations that may not be able to afford the services, right? And or don't have insurance, and it's really difficult, right, to provide care. And so you get contracts with individuals that meet that population, that fulfill your different cups. And so I was able to continue to work with children, incarcerated children. And that was something I became very passionate about during fellowship. And I became the director at a youth prison, and I loved it. And I was very sad to have to leave that position. But next thing you know, 1 year later after I left, I was very fortunate that they came back knocking on my door, asked me to return. And, through your help, you said, go back, but you'll go back as a contractor, not as an academician. And I did.
On your own terms, right?
Right, and my terms.
Good.
That's right, my terms. And I love it. It's a hard job. You put up with a lot of trauma, a lot of difficult systems, a lot of children who are just suffering in prison for the obvious reasons. And I can show up there and be my true authentic self and not worry about the politics and just be there fully present, providing the excellent care that they deserve. And so I was able to get that contract. And also around the same time, some other organization came knocking on my door saying, hey, you're a Spanish-speaking child psychiatrist. You're one of 3 in the state of Washington. Would you like this opportunity to help detained youth or unaccompanied detained youth? And I jumped on it, and now I've been working with that organization for almost 3 years, a little over 3 years now. And again, every year I renegotiate my contract, I reevaluate my worth, and I'm able to show up present and treat Spanish-speaking children or treat detained youth, give them the best treatment possible, and get paid what my worth is. So that's been very rewarding.
You have said all of the high points. You are doing something you're clearly so passionate about, you're so good at, you've trained so long for, and a population that needs you. And at the same time, maintaining your own worth and not just accepting, say, first offers, not just saying, oh, I'll do this for free, but recognizing, no, I'm a valuable commodity. I'm a valuable asset here. Yeah. Not everyone can do what I can do. And I have every right to negotiate my worth in this setting to be able to continue to do what I love and what the community needs. Right. So that was great. Thank you for also mentioning on, those hesitations in leaving academia. I always want, the listeners and physicians I speak to recognize that this is not our fault. All of those things that you said, all of those hesitations that you had, that feeling of I may fail, I may go broke, I may lose it all. I think that those are those are planted by design. We go through all of this training and we're not exposed and we're not really given quote unquote permission to do these things, to do this kind of career exploration that is more allowed maybe in other fields of law or business or finance or entrepreneurship or anything else. We are shunted straight into academia often or given two paths. So those feelings of hesitation, I think, are so they're planted there. Yeah. I think we all have them, and we shouldn't feel any guilt or worthlessness that, I can't make it on my own. It's not your fault, that you would feel that way after a decade or more of training in medical academia. Right. But so many of us, as you described, got to a place of recognizing that we needed and deserved more and different from our careers.
That I agree with everything you said, and it's been so relieving and so enjoyable being able to. I still have my research team meetings, still work on my manuscripts, still have research assistants, still be able to mentor pre-med students, still have these pre-med students. I just have one med student I'm so proud of. I've been working with him for about 4 years, first generation pre-med, and now he'll be going to University of Washington Medical School starting in a few months. Wow. So we're still working on our research. And great. I also can just put on my private practice hat and say, okay, research pause these next few days, private practice owner. And now I'm excited that I'm growing my private practice as well, and really just tapping on the shoulders of some really great faculty that I highly respect and have worked with, and have been sort of telling them, hey, there's a better way. You can still keep treating very severely kids at the inpatient unit, which I still love to do. Sure. And that's still some of my clinical work at the university. Besides research, I still have to work either in inpatient unit or cover other clinics a few days out of the year, but that's my clinical responsibility. So I've started tapping on these faculty, and I've been very fortunate that two also have said, you know what, I think I'm ready to take that jump. And so they'll be joining my practice. My first colleague, Dr. Glass, starts tomorrow. So I'm very excited to be growing and expanding.
Congratulations.
Thank you.
I'm so impressed with how you've been able to do what so many physicians are scared of, which is leave a job, leave academics, and not burn bridges. You clearly have maintained so many of your relationships within academics with so many of your colleagues. You've probably heard physicians say it. I certainly have. I don't want to burn a bridge. I don't want to not be a team player. And so often that keeps us, in these jobs. But how would you say you have been able to maintain so many of those relationships outside of academics?
That's a really great question. Well, it helps that I'm still partly in, right? So I haven't left, and I think that helps.
Yes. So what is how much time is it, like a 0.25 or how do you have an FTE in academia?
0.25. That's actually a great guess. Yes.
Oh, good guess.
Yes.
Okay.
And so
did not know. Okay.
So I was able to work with my department chair and division chief. He was actually, my division chief was really great about me trying this out. And the first 2 years, I just was doing anything that they wanted me to do, covering the inpatient unit. And after the second year, I realized how difficult it was for me to do complete their clinical requirements, but then also manage my private practice. And I spoke with him about it, and one of my academic mentors and research mentors gave me the idea of, well, what if you consolidate your work and you're just out 1 month of your private practice, or a week at a time, and it's less fragmented, it causes less financial not problems, but hits for the private practice, right? And my division, I presented it. I said, look, I want to stay on. I want to continue to provide services for you. And this is what's going to work for me. Otherwise, I won't be able to continue. And he agreed. He said, that works. Let's find something that works for you. So he was accommodating as well. Great. So, I work a few weeks out of the year, and I'm able to maintain my faculty position. And I did have to make that change from tenure track, or the typical tenure track, to clinical, right? And for a lot of us academic snobs, that would be like, you remember that, right? That idea. And again, it was a gift, right? There was a huge gift with making that change.
Good. Thank you. Thank you for explaining that so well. I think so few of us have examples of physicians who've been able to be lifelong academics until they're not, and be able to maintain those relationships, maintain so much of the things that you enjoy doing, maintaining your relationship with incarcerated children and those other contracts that I think have come out from maintaining such great relationships.
Yeah. And to answer your question, I'm glad you're reprompting me subtly here. That's excellent. Excellent skills there. Maintaining relationships, right? I think just being your true, authentic self when it comes to your clinical work, right? We all know that most of us cannot be our true, authentic selves in a lot of academic institutions. And but being your true, authentic self with the quality of care. And I'd like to think that it's a very humbling and very gratifying experience when you have colleagues refer to your private practice, right? Or when your colleagues refer their own children, or when you treat your colleagues' children, right? And so it speaks volumes to the trust that they have. I think that helped me, right? My good work speaks for itself, and it maintains my working relationships. And still having a connection, right? And still going to some of the research meetings, and still showing up in spaces and reminding them, like, hey, I'm still present, a little differently, but I'm still present, right? And so that's been very helpful as well.
Great. And I will say, I feel like we've had so many, there's been a lot of positives here in your journey outside of academics. I'll give a slightly opposing view that when I, went to leave academics and proposed it to my boss, I was not met with the same, it sounds like, collaborative accommodation that you were met with. So, to the listeners, you may get different feedback. You may get some pushback. It sounds like Dr. Montenegro here had a great experience, and I'm so glad I had somewhat of an opposite experience. But either way, you and I still both decided, our way out of academia was our path to take. And I know I have no regrets. It sounds like you have none either. So despite what your department chair, your medical director may say, if you approach and propose like you so artfully did, proposed, a schedule or an agreement, that may be accepted, it may be rejected, but either way, you have every right, physicians have every right to work in ways that serve them best. I've heard a physician say they're not allowed to go part-time or not allowed to go per diem.
That's right.
We get that a lot. I mean, we earn a lot of money for institutions. So yes, I can imagine they would want us all to work full-time for them for the rest of our careers. Right. But I'm here to say, and I think Dr. Montenegro is here to say as well, that you do not have to do that, and you can create and chart your own path in your own way. So thank you for that.
Yes, and like I said, it sounds daunting. It may feel very scary. Thinking about having your own business, right? A lot of us never think about having our own business, and that is just a new challenge. And I always think about it this way, right? One of my mentors in residency would always tell us, never struggle alone, right? And so I was able to reach out to some of my colleagues in California and even in Washington who, right after fellowship, said, I'm doing my own thing. They were able to guide me and help me. And people like yourself who have this experience. And now I'm helping people also be able to think creatively, right? How can I really practice medicine in a way that doesn't burn me out, in a way that lets me provide even better care than I can when I have all these other restrictions or stressors? How can I be more financially secure so that I don't have to fear taking risks as well, right? In terms of feeling like you're tied down to an institution, right?
Sure.
And so it's scary. You may, quote unquote, fail, but even if you fail, it's still an upward fail, right?
That's right. You're failing forward.
You're failing up and forward. Right.
Failing forward, and quite frankly, and yes, I'll say fail lowercase f.
Yes.
There's no, in my humble opinion, no such thing as failure for physicians at this level of training. Try something new. There is some inherent risk, a little bit, but at the end of the day, the benefits are far, far, far outweigh them. Yeah. And as you said, you don't have to struggle alone. I love that. I'm going to start using that. Yeah. So I think that's a common theme through with so many of my guests who made that step, is that they found other physicians who had done it and who were doing it. And I found that physicians outside of full-time academia are so free with their knowledge, and they want to help, and we're not keeping our good thing close to our chest. It's like we've found such happiness and freedom and autonomy and flexibility, and we're good people, and we want, I think we know it's good for the profession and it's good for all of us. Our success is all of our success.
Absolutely.
And I think the things we want to change in academia will happen when enough of us know that we have options outside of it. We can be louder about making noise inside of academia when we know we have options, right?
Right.
And we can hopefully make that change, because we should be able to stay in full-time academia if we want to.
Right.
And it shouldn't be a toxic place with the old guard and the hierarchy and things that can't change.
Right.
It takes all of us doing that, and I believe it can happen. I'm an eternal optimist.
Yeah, I agree with you. And this kind of flexibility, it recharges you. So when I'm doing my private practice and I'm seeing the patients that I want to see, and I'm seeing my guys from Meta and my people from Google and all these other corporations here in Washington that are so brilliant and struggling and suffering in different ways. It's so intellectually enriching having these types of treatment sessions. I can go into my academic space and put up with some of the old difficulties, some of the struggles, some of the frustrations way more easily, because I'm being energized and recharged elsewhere, right? And so
you're right.
It's a win-win.
It is. And that diversification of practice, I agree. Working in different ways, it expands your mind. It keeps you fresh. It keeps you on your toes. It keeps you sharp. That you can, as you just described, work with different populations, different people, different types of people, different times, in different ways. I completely relate to the way that it just starts charging and energizing you, and say, wait, I can do it. I can see those people, and you bring those experiences to your next type of patients, but it all goes together. We're all people, and it's a beautiful thing.
Yeah. It reminds me of last time you and I checked in. I think you were working in the NICU or something, where I was thrown off. I was like, wait, you were doing labor and delivery, and now you're with really sick kids in the NICU, and you're like, yep, I can do it all. Yeah. So, yeah.
yeah, exactly. I mean, those are closely tied together, but as you know, I do all types of things, whether it's consulting or expert witness or veterans. And, again, as a pediatrician, I think I thought I was the most restricted of any specialty in terms of what I could do outside of clinical medicine. But I think we are all proving that to not be the case. Before I let you go, let me ask, you have a large, an arm of your practice is devoted to physicians and physician mental wellness. What would you say to a physician listening now who is maybe not plugged in with, a mental health professional, a psychiatrist, feels like psychiatrists wouldn't understand exactly what they are going through. So what would you say to such a listener?
Similarly to what I mentioned, what my old mentor said to me, I really live by that motto and practice by that motto. Don't struggle alone, right? And there are a group of us who have and are specializing in treating physicians that, for example, make ourselves accessible to helping other physicians by providing physician coaching instead of therapy or treatment, because then we can be able to provide more guidance, obviously staying within the clinical guidelines and ethics of not practicing psychiatry, but still being able to help colleagues around the country without having to worry about licensing.
I see. Oh, that's interesting. So you're saying coaching versus, a psychiatrist like yourself providing physician coaching rather than a official psychiatric care kind of opens up some more flexibility, more... I see. Okay, that's access. An important distinction. I'm sure not a lot of people know about
they're
that.
Very different, and you have to be careful, right? When you seek out services. And again, we can all benefit from coaching, from therapy.
We can.
You have to be very careful when you're looking for help, right? To find someone that's able to tell you whether or not they think you need psychiatric care or coaching. And there aren't many of us out there doing this, but you'll find a few psychiatrists who are doing this. Putting yourself first is difficult. Oftentimes, especially when all of our training is about helping others. And when we start helping ourselves, we start seeing that things get better, our lives get better, we become happier, and our practice becomes happier, and our practice becomes better as well. So put yourself first. It's difficult, but there are people out there willing to help you.
Well put. And I think another distinction in there is that if you are providing coaching, you're not bound by, say, your state licensure. So you could maybe coach physicians in other states. Is
absolutely
that true? I see. Okay, so true. Psychiatry within the bounds of the states where you're licensed, but coaching really for any physician.
That's right. That's so, for example, I'm licensed to treat in Alaska, California, and Washington, but I could coach. I have quite a few physicians from Wyoming and Idaho that I coach. So it's very helpful. And oftentimes a lot of physicians feel more comfortable getting coaching for fear of retaliation or legal consequences. And if you do need psychiatric care, it's important to find a psychiatrist that knows how to navigate the fear that a lot of physicians have about board certification, hospital certification, and licensing certification. Credentialing, thank you. That a lot of physicians think if I receive mental health services, it's going to be in my records and it might hurt me in the future. And it's a fine line. Which is unfortunate. We should all be able to get the mental health care that we need. And I always say it's better to err in getting the care than struggling and then losing something that you've worked so hard to get.
That's right. That is absolutely right. Well, as we wrap up, I'm going to close with the question I ask all of my guests. And that is, this current version of your career, as it currently is, did it just happen on its own? Did it fall into your lap, or did you have to take some action in order to create it?
Great question. I think it's a combination of all three, and that feels like a cop-out. No, some opportunities did land on my lap, right? Where people reached out because of my expertise. Okay. And The rest, I did have to put in the work.
Right.
And I did get help. So I do think that it's a combination of what you've mentioned. It's a journey that I wasn't expecting. It's a journey that a lot of us don't expect. It's a journey that a lot of us don't even think we can take part of. But it's been so gratifying now that I'm helping other colleagues also live a life that they feel is more rewarding, that still combines their passions, and still allows them to help the patients they want and provide the best care possible, is very gratifying.
Okay. Well, thank you for that. And thank you for joining me on this podcast, Dr. Montenegro.
Thank you for everything that you do, and thanks for helping other physicians become liberated from what sometimes feels unfortunate prison.
Yeah, I appreciate your being here, and we will have and include all of Dr. Montenegro's links and ways to read more about him and his practice on the website. And thank you for joining me.
Thank you, Dr. Lawrence-Reid. Take care.